All right, I am here with my chiropractor therapist, and he's been helping me out with my, what are we calling it?
A proximal insertional hamstring tendinopathy.
There we go.
Yeah.
So I've been working with Dr. Rick over at Station Street Health for probably coming on a year and a couple months or so. So he helped me through my prep. Now I'm in my off season, we're gonna do it all over again. So I appreciate your help.
No worries.
Yeah.
My pleasure.
And you can find his stuff over on Instagram under Station Street Health, and they also have a YouTube page, which I will link in my description. Please make sure you subscribe to my channel as well as Station Street Health, and we're trying to look to get up to 1,000 followers, so be that 1,000th follower.
On with it.
It's fine. It really hurts
Yeah.
still, but I know it's only been a week. But it did feel good after the treatment.
Yeah.
So it felt good for that day, and then I have discovered that heat definitely helps.
Yeah.
But
Good.
still, today's really bad, but I think it's probably because this like weird shift in weather. I'm one of those like barometric freaks where
Fair.
it's like if
Just
it's cold or
respond.
yeah.
Respond to everything.
Yeah, exactly.
So keep doing the heat. It's also
Yeah.
the morning, so it's going to take some time to warm
Yeah.
up and all that.
Yeah.
Compared to last week, better, worse, the same?
Probably the same, not worse. But
Okay.
yeah.
What you're doing at the gym, is that more intensity-wise, rep-wise, all that?
Yeah, so I started doing more of the eccentric work
Yeah.
with the cables. Literally nothing heavy, like the lowest weight. They don't have a laying leg curl. And I actually like it doing with the cable because my knee doesn't hyperextend at all, so there's not like an extra stretch in the hamstring.
Yeah.
So just
Good.
making small progressions.
With
I
the
guess.
eccentrics, this is the first time you've played with eccentrics?
Yes.
Okay.
Yes.
So let's use that then as the new, like, I guess, benchmark.
Okay.
Basically next week, can you tolerate more load?
Yeah.
How does it feel if you do the same weight?
Okay.
Kind of deal.
Yeah.
Okay, so let's get your face down.
Cool.
Okay, laser.
Feels so full.
So what are you guys up to for the rest of the day? Just
Nothing. I work at 4, so it'll probably be, that's it.
You never know, you may get like all the snowstormers coming in.
Yeah, maybe. Well, it's also supposed to just rain until like 9 o'clock tonight.
True.
So I don't really know what's gonna happen.
Ask Dr. Rick what you're doing.
It's putting it in.
Oh, look what I can do now too.
Squats. Chinese.
All the way
Like
down.
that?
All the way down.
Like that off.
Yeah, do heels down though, that's the problem. Alright. I really enjoyed this treatment last time, and it didn't hurt last time, so Dr. Rick is doing it again, but it is called dry needling.
So we're using single-use sterile needles. It is technically contemporary medical acupuncture, but basically what I'm doing is I'm tracing her biceps femoris, popping a bunch of needles into the muscle belly. We're gonna leave them in there for a little bit, and then on the way out, we're gonna do something called a dry needle, where we cause some micro trauma in the tissues, and this essentially stimulates the healing process. Creates a lot of blood flow in the tissues, all the nutrients, everything that it needs to heal up. That last one.
Yeah.
Okay. They're all in, so I'm gonna let you cook here for a little bit. All right, got a nice little snooze.
Later.
I haven't heard anything. I'm gonna assume, but
Good call. So our standard protocol for like snow days is basically follow the public transit system. So if they close down, we close down. Mind you, we leave it up to our practitioners. Like if you want to come in,
Yeah.
come on in. If you want to take the day off, we just have to leave patients go for it.
yeah.
So Alyssa has a really good pain tolerance when it comes to treatments like this. So most patients I could not actually even do this with, especially doing this many needles in. But lucky for her, she can tolerate it really well. And that's typically like when you pop a needle in, you're more sensitive, just literally that tap through the skin. Everyone describes it differently, but generally it's like a deep kind of like
Yes.
a boring sensation.
Yes. That's exactly what it is. Oh. Good one.